Hi, hi, good afternoon, everyone. You are welcome to another edition of the Yaba Voice webinar. We are excited to have you join us today on this special edition. And now, why would I call it special? It's special because we get to celebrate the Men's Day. Now, you would hear stories about why we don't celebrate the men. Oh, we don't celebrate men. It's usually women, 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 women. But yes, we get to celebrate men. And so yesterday was the International Men's Day. As a matter of fact, we are dedicating the whole of this month to celebrate our men for the wonderful job that they're doing, for being active, for being diligent, for being wonderful. I want to welcome you especially to this edition of the Yaba Voice webinar. And also, we have very, very important people in the house today. Please note that if somebody that needs to be here is no longer here, just give them a beep and say, "Oh, hello, hi, are you ready?" Because something serious, a serious conversation is going on today. To formally welcome us to this webinar is my medical director, Dr. Lubenga Adekile Oweye. Incidentally, I learned he's in a meeting, but I hope he will join us shortly so that he can welcome us to this very important conversation that we're having today. Today is not just the Men's Day, it's also a day where we get to also celebrate and to also thank everyone for the last edition of the Yaba Voice webinar. It's not here yet. We would have to kickstart this conversation and hopefully trusting that it will join us as soon as possible. With me today, we have very, very important personalities, individuals who had distinguished themselves in their profession, individuals who had also made very landmark and portable impact in the field of mental health. I'm talking about Dr. Adeshino and Dr. Koka. They are the very special guests that we have in the house today who will be taking us through this conversation that we are talking about today, bridging the silence, promoting men's wellness, promoting wellness among men. Yes, we do not get to talk about men, but today we are talking about them and we are opening this conversation right away. Please note again that we are also streaming live on Facebook. So if you cannot connect here, you can also join us on the Facebook page of the Yaba Voice. Yaba Voice FMPHY is the code, and then you will be able to also watch live as we do this conversation today. Now, Dr. Adeshino, can somebody just confirm that Dr. Weye is not yet here? Before I move on, please, just a minute. Okay, is not yet here. All right, so we'll kickstart this conversation, and Dr. Additional will be talking to us about, yes, who is a man? We are talking about men. Who are we talking about exactly? And then we're talking about men's mental wellness. What does it mean? And what are the prevalent conditions that are, or mental health conditions that are common to men? Over to you, Dr. Additional.
Okay, thank you very much, Dr. Akintoyeshi. I feel so honored to be part of this wonderful occasion to celebrate men. Of course, I'm one of the people being celebrated, so it gives me so much joy. So, who are men? Well, men are individuals who are naturally created to be of the genetically the XY, who have the XY chromosome, and they are, of course, naturally created and culturally nurtured, and as well as socially expected to be protectors, to be providers, and in an act to put these responsibilities together to meet the social expectation and their natural creation actually puts men under significant amount of stress. Yeah, so when we talk about men's mental wellness or men's mental health, it's similar to defining the mental health or mental well-being of any other individual because men are humans as well. And according to the World Health Organization, we talk about mental wellness as a state of well-being in which an individual is able to cope with the daily stress of life. So World Health Organization realizes that as long as you are alive, there will be daily stresses. There will be stressors that you face on a day-to-day basis. So ability to cope well with these stressors constitutes one of the dimensions of mental well-being. Also, is a state of well-being in which an individual is able to work productively. So for a man, you'll be considered mentally well if you're able to work productively, and also if you're able to actualize your potentials, and also a state of well-being in which an individual is able to contribute meaningfully to the community. So these are the four pillars on which World Health Organization define the mental well-being of any individual as well as the mental well-being of men. So those are that is the angle to look at the mental well-being of men. So going to the second part of the um, question, which talked about what are the common disorders that men experience. Well, looking at men from the angle of the biological makeup, from the cultural nurturing and grooming, and the social expectation that makes them to be providers, to be protectors, this puts them under constant stress in an attempt to meet up with these responsibilities. So when this constant stress is going on in their lives, they are predisposed to some other forms of mental health conditions like anxiety. In fact, there are times when there are doubts that are they able to meet up with these responsibilities? Will they be able to succeed? So this brings up a lot of anxiety in them. Men can go into depression. From depression, there could be some other things like somatization disorder, where psychological or mental crisis actually manifest as bodily symptoms. So these are some of the disorders that we commonly see in men. In an attempt to cope with all this stress that we've talked about, you see a lot of men going into substance abuse, using psychoactive substances like alcohol, cigarettes, and a whole lot of other ones that we all know, cannabis, cocaine, a lot of all those things, to actually cope with the stress in order to self-medicate themselves and have some kind of relief from this constant stress that they are exposed to on a daily basis. Also of importance is the fact that um, meeting the responsibility of being a provider, being a protector comes with a lot of financial responsibility, a lot of financial inputs. You see men working around the clock trying to make provisions for the families, for relatives, for friends, for a whole lot of different people. Um, Many people face a lot of frustration in trying to achieve this, and you see them a number of times trying to look for shortcut methods, of making money, of making ends meet. This could force a lot of men into gambling. So people start with gambling, and before you know it, they find themselves in the pit of gambling disorders. So these are a whole lot of mental health conditions that we can find in men. And we need to also remember that because the body houses the mind and the mind controls the body, while all these mental health conflicts and crises and disorders are happening in men, they drive along with them some form of um, physical health conditions too that share similar pathology of chronic stress. These conditions include systemic hypertension, diabetes mellitus. You see a lot of men, when you ask them, what is your blood pressure? They will tell you, my blood pressure is always normal. And this person has not checked the blood pressure in the past 1 or 2 years. And he has undergone a lot of constant stress trying to meet up with the demands that we've talked about. When you check the blood pressure, we discover that a lot of men are working with alarming blood pressure of 200 and something over 120, 180 something over 100. We see that a lot at the emergency unit, and you'll be like, wow, you are carrying this kind of blood pressure around. So systemic hypertension, diabetes mellitus, other medical conditions often coexist with this mental health crisis that men undergo. What we see in the end is lower life expectancy for men. You see men dying earlier than women, maybe as a result of suicide, either in men because of the unresolved mental health crisis. It may be as a result of maybe as a result of sudden death. You see sudden death from these cardiovascular complications that we've also talked about. You hear men slumping at work during the peak of activity and some other stuff like that. And it could also be as a result of accidents. It's been shown that accidents are more in men because of reckless and high-risk lifestyle that we are going to talk about maybe again if we have some time. Thank you very much, Dr. Kintoyeshi.
Thank you so very much, Dr. Additional. You know what you just said now made me recall from a few weeks ago in church. Men were asked to pray. I will not die before the day of celebration for my children. And all the men in church were praying. But you know what you have just mentioned now? It's also a very key factor. And most of them are not here. Please, if you know any man that needs to be here, tell them to come. Oh, lower life expectancy. That's what Dr. Additional mentioned. A very core factor in all that we are talking about. But please, before we run off, the medical director is here. Our medical director is a very versatile person, and he's also our number one man. So again, we'll get to celebrate him today. But please pardon me. We're going to take the welcome from the medical director now before we now continue. Over to you, Dr. Olubenga Dekele Owoye.
Thank you very much, Dr. Akitoyese. I want to apologize sincerely for coming in, as a result of this strike in the health sector. I had to be engaged in various meetings. So kindly take my apology, accept my apology for the delay in coming in. Be that as it may, what we are discussing today is bridging the silence, promoting the mental wellness among men. Bridging the silence, promoting the mental well-being among men. And as you all know, Yaba Voice, the platform upon which we are operating, is for education, advocacy, and community outreach. And that there is no way we will present without talking about the mental health of men. And there is no health generally without mental health. And this is because the health of the populace is hinged on three tripods of physical, mental, and social well-being, not just merely the absence of diseases. And not that alone. Men's mental health is a crucial issue, often affected by societal stigma and traditional gender roles that discourage emotional expression and help seeking among men. While men may be diagnosed with depression at lower rates than women, they have significantly higher rates of substance use disorder and complete suicide, just like we have heard. And the question that we are trying to ask today is that, what do we understand by the mental health issues in men? Are there mental health challenges peculiar to them? How did they develop? And to address the issue which we have been doing now, we have had our first presenter, who is Dr. Ismail Adesina, a consultant psychiatrist and a therapist certified by the Association of Psychological Therapists in UK, an award-winning scholar who emerged as the overall best graduating fellow of the Faculty of Psychiatry of the National Postgraduate Medical College in 2025. He's a prolific writer and researcher with over 20 publications in local and international peer-reviewed journals. He also has over 20 conference abstracts to his name. And if you look at our second presenter today, you will discover that we are loaded. The second presenter is Dr. Olubenga Damilare Kokwa, a clinical psychologist with proficiency in dialectical behavioral therapy, mind focus, cognitive behavioral therapy, EMDR, and so on and so forth. And he helps individuals and families shift paradigm and develop competency for functional and adaptive living. In addition to his clinical practice, Olubenga is a learning and development faculty in the corporate sector, where he design and facilitate impactful mental health and wellness programs that foster psychological safety, culture, and module operandi work-life balance. He's also involved in leadership development, emotional intelligence, and productivity in the workplace. His integrative approach bridges clinical insight with organizational development, making him a trusted voice in promoting holistic mental health and purposeful living. So he's an alumnus of various universities, University of Denver, Lagos Business School, University of Education in Ghana, and so on and so forth. And so you can see now that those people talking to us today, they are well loaded. I want to encourage us to kindly relax and listen more to gain more knowledge and experience from this individual. Thank you. Over to you, Kemi Akitoyese.
Thank you so very much, Medical Director, sir, for welcoming us onto this platform. Again, we apologize. It was a technical issue at the beginning, but we are here and we're good now. Dr. Dikino had told us that genetically, a man is called a man. Culturally, it's also structured and packaged to shoulder responsibility, play some roles, and that's what some of the things that highlight or differentiate him from the other gender. But more importantly is the fact that they go through quite a whole lot of things. And as a result of that, they could come down with anxiety, depression, substance use in B2B to deal with some of these challenges. Again, sometimes they go into gambling just to get more wealth, more money, solve their problems, carry on with the loads, the cultural expectations. And then sometimes also they may come down with some physical ailment, hypertension, diabetes, and other things like that, which could lower their life expectancy. And now Dr. Coker will be talking to us about the factors that can affect men's mental wellness in our society. What are those factors specifically? Over to you, Dr. Coker.
Thank you very much. I want to say good afternoon, good morning, good evening, wherever you are listening from all over the world. Yes, today we are bridging that gap. And so what are the factors that are affecting the wellness of men in our society, in our world today? So like Dr. Additional has said, the first thing that is very prominent that we need to mention is the genetic makeup or the makeup of every individual. And this also actually pushes a bit further. Not only that, also determines certain chemicals, certain hormones in our body that makes an individual vulnerable to certain things, to certain pressures, and others resilient to such type of pressure. So number one, I would say genetic makeup of every single individual and the emotional differences, because we have individual differences in each individual. What does that mean? We say some people, they are very good at taking notes and writing things down. Some are listeners, they are ardent listeners, they are very good at that. Some are judges and some are observers. So we have different personality types, we have different personality profile that make an individual actually susceptible to certain life challenges or another, also make them important or overcome certain challenges like that. So that is the first part. Then the second one, which we have also been talking about today, is the social aspect, the societal expectation of the gender role or the male gender. All over the world, there's something that is expected of a man, of the male figure. And let me say, like our doctor has rightly defined who a man is. So beyond, we say a child is born male, but by his ability to accept responsibility, he becomes a man. Because responsibility is what differentiates a male figure, a male gender, from being a man. The ability to, one, grow by learning. Two, by observation. Three, by resource person, stay under tutelage. Then four, take responsibility and provide the result for their own self. That is why we say they are men. And one of the fundamental characteristics of a man is his ability to lead, his ability to lead. And when we talk about leadership in two spheres, the first leadership sphere is his ability to lead himself, ability to coordinate himself, to coordinate his emotion, to coordinate things around him, and eventually ability to lead, which is ability to influence other people to achieve a worthwhile goal. So that is the other part of it, which is the societal expectation and the understanding of himself when it comes to genetics and leadership. The third part of it is the part where we refer to as toxic masculinity. It's one of the things that negatively affects men in our environment. What do we mean by toxic masculinity? When there is this assumption or belief or schemas in our head that, number one, an individual man is supposed to be able to repress or suppress his own emotion, one, and eventually starts asking or shutting other people down too. That is toxic masculinity. Then we talk about aggression, the violence that is shown as a form of strength. Ladies and gentlemen, violence or aggression is no sign of any kind of strength. In fact, as a matter of fact, true strength is strength that is brought under authority. So authority of oneself, an individual's ability to rule over himself, an ability to submit to the rules or the guiding regulation of his environment or part-time. So then another one is dominance and control, which I have just explained. Those are part of the things we refer to as toxic masculinity. Then objectification of women or misogynism. So in a place where an individual does not just like say, a woman should not talk where I am. You know, I am the Lord and the head and the agu of this particular family. So nothing happens except with me, and it's me. Any other person or every other opinion, especially by the female gender, should take a second position, is subordinated. So these are examples of toxic masculinity. These things are important that we note them so that we can start checking or start ticking. Do I have some of these signs? Do I have some of these things inside myself? And how are they actually deterring my life? How do they deter? Because a lot of us know that the female gender actually has a lot in intelligence. Many of us, or all of us that have gone through school, we discover that there are certain times that you see, in fact, a lot of times that women actually can outdo a guy because they have the mind, just like the guy has the mind or the technical or the intelligence to be able to cope. So that is not what we are talking about. We are talking about this guy as a figure of strength and a figure of leadership and as a figure of respect in his environment. So when we mix up these things, then there is a lot of trouble. There's a lot of problem. Another factor in the toxic masculinity is what we refer to as the issue or the use, like doctor has said, of alcohol, of drugs, and certain, risky behavior, or in some other circumstances, we engage in certain uncalculated risky behavior. So calculated risk are those ones that will say, okay, if these things don't go as planned, this is a plan B. Uncalculated one is the part where we just do things based on impulse and we don't think it through before we do. And risky behavior is certain individual that is just going around doing anything they feel like doing part-time that can actually jeopardize, one, their freedom, two, their health, and three, their lifespan, like our doctor has actually spoken about. So another factor that affects the mental wellness of men in our environment is the perceived lack of emotional support. I use that word perceived lack of emotional support because some of the time some persons two children can grow in the same family and one believe that, yes, oh, my father or my mother actually cared for me, they supported me in their little way. And the other one is saying that, what are you talking about? I did not feel any kind of care or support while growing up. That is why we call it perceived. So, and this is secondary to the type of attachment style that they have and the ego stresses or certain things like that on their inside. Another part that becomes very important that we need to look at when it comes to... Hello, can you hear me?
I'll have to cut. Just round up in 1 minute. You still have lots of questions to still attend to.
Oh, OMG. So another factor that we need to talk about is relationship issues. An individual man's relationship with money. Somebody says that he doesn't take alcohol. And we are saying that you are not taking alcohol because it's expensive, you don't have money to buy it. So when you have the money, we can now see if you really don't take alcohol. Relationship with spouses, relationship with children, relationship at work, relationship at home, relationship everywhere that they find themselves, relationship with both things and human as well. These are some of the factors, a few factors that actually affect our mental and emotional health when it comes to men. Thank you very much.
Thank you so very much, Dr. Coker. And one thing that you said that resonated so very strongly with me is the fact that violence and aggression is not a sign of strength. And usually people will do or think that it is. But the true sign of strength is when you're able to master your emotions. And that's, I think, should be a take home for our audience today. And it's also something that we should propagate out there. Dr. Additional will quickly be talking to us about what are some common but often overlooked signs of mental distress among men so that we would know if these signs are there and we're just overlooking them. Over to you, Dr. Additional.
Okay, so having talked about what makes a man, it becomes easy for all of us to understand why men tend to put on a mask of strength, put on a mask of stoicism and self-reliance. This mask actually covers a whole lot of distress going on in the minds of a man. So for us as mental health specialists and for every one of us here, to be able to help a man, we must be able to look for the mask and remove it, so that we can identify the distress that they are going through. Commonly, most of the symptoms of mental health in men are usually covered under that mask, and they include undue irritability. The number of times when you see a man being unduly irritable, getting angry at little or no provocation, and the wife will be wondering that, this is not the man I married. He has changed over the past 6 months. He has been getting angry easily. Some men progress to the point of aggression, domestic violence, beating the wife, beating the children anyhow. So these are some of the things that when we see them, we should actually know that this kind of man is struggling with something that is psychological. Also, you see some things like what we call escapist behavior. Escapist behavior are things that they are behavior that tends to help a man to escape from his head, to escape from the pressure that he's going through. For example, everybody is closing by 2, he doesn't go home until 5 p.m. He goes to the gym, spend 8 hours while everybody is spending 2 hours. And the gym instructor even have to be telling him that, Mr. Man, it's time to go. These are some of the escapist behavior that tries to help him divert his mind, from the crisis running through his mind. We also see things like high-risk behavior, like reckless driving. We see uncalculated high-risk behavior, like Dr. Coker rightly said, things like gambling. There are a lot of other ones now, a lot of things going on in the crypto space. You see a man who has not who has not paid the school fees of his children, who has not paid house rent, and he uses the money to go and put it into crypto, something that is high risk investment that can crash at it at any time. It is because he's going through financial crisis, a lot of psychological crisis of financial origin. So these are some of the things that we see. Also, you might be able to see a man who has not been using psychoactive substances before, and all of a sudden he has started taking alcohol, he has started smoking cigarettes. And for even someone that has been using before, there might be a recent increase, in the amount of those substances that the person is taking. These are some of the things that we see in men that serve as a kind of a pointer to a mental health crisis. Also, you might see things like poor sleep. Commonly among men, when they are anxious, when they are having psychological distress, when they are depressed, when they are going through stressful conditions, they tend to have difficulty falling asleep, especially initiating sleep at night, or even sometimes they wake up intermittently. A man sometimes may wake up to 5-6 times in the night, before daybreak. You might also see things like erectile dysfunction. When a man complains of erectile dysfunction, or he might not even complain, the wife might just notice that he has lost his sexual drive, he no longer has erection and can no longer perform his conjugal relationship. That might be a pointer to the fact that this man is going through a lot of psychological distress. So these are some of the things that we see in men that are often overlooked, but they help to identify psychological problem in men on time, and such men can actually be helped if these things are picked on time. Thank you, Dr. Akintoye.
Thank you, Dr. Adeshino. What you just said now opens up a very important conversation that oftentimes you see a lot of men, they become lion of their house, not the tribe of Judah now, lion of their house, very irritable and all of that thing. And most time people will not say that's his personality. That is personality. We'll come to that. I'm going to ask you, is that his personality, or is there is something that is tickling his nose? But let's quickly move on because of our time. Dr. Coker, why do you think men now find it difficult to talk about their emotions, especially with what Dr. Adeshino had mentioned? Why do you think men find it very difficult to talk about their emotions or their mental health challenges? Over to you, Dr. Adeshino. Sorry, Dr. Coker.
Thank you very much, Ma. Once again, it's important that we know certain things. So what an individual finds from the foundation or growing up as a child becomes part of the things they grow up with, how they grow up, and how they conduct themselves haven't grown up. So identity is very, very important. So if an individual has lost their own voice, they have lost their own identity as a child. In fact, that is one of the reasons why we are bridging the gap today. It becomes important. Whatever it is that is modeled in the home environment that they grew up in, or in the society that they grew up in, becomes one of the factors that predispose them or that determines the way they will behave when they get out there. So one, when the role models in their life were not able to be vulnerable enough to be vulnerable and model that vulnerability, the man also goes, the child grows into a man and is not able to be vulnerable enough also to other people. When vulnerability is classified or categorized as criticism. They're seen as an emblem of weakness. So then the individual also decides to say, okay, you know what? To show the world that I am not weak, like I have a point to prove, I need to actually start keeping a lot of these things to myself. I'm talking about a point to prove. So we used to say that a child cannot cannot shut up, except that you shut down the child. So when this child was growing up and say, you talk too much, you talk too much, you talk too much, and this child is talking based on the processing in his brain. Now he is a man. He is now finally being able to shut himself down, because that is the only way he can be acceptable by the society or accepted by the society. So now they have learned to bottle up everything. They are the child, the perfect child that does not require or demand anything from their parent or from their caregiver. So now that they have grown, they have learned that the only way the environment or the society can accept you is by shutting or bottling up your own emotion. Those are part of growing up. Then now that we are grown, what are the social expectations for individuals? Say, no, a man does not cry. Ladies and gentlemen, and so this particular person says that, okay, for me to be acceptable, I need to shove it down, I need to swallow it and not cry. Some other things is that the fear of being different, the fear of standing out within the society. So we now go into a form of conformity, and this one actually affects our ability to be vulnerable, ability to speak, ability to design, and ability to allow the world to know the way we feel, to share our feelings with our world. Like Dr. Adeshina said, wearing masks. A lot of people are not only wearing masks, they are already pressed mute as well. So this thing affects us a lot. The fear of being judged, the fear of rejection or shame, then the perception that vulnerability, like I've said, is a sign of weakness and not a sign of strength. And most often than not, even as an adult, a lot of people want to run life by assumptions. We want to run life as we see fit. But some other persons that have right role model in their life, they say, oh, this person is actually, they have actually succeeded ahead of me. This is how they live their life. This is what they did. This is what they did. God help us. If that role model was one of the persons that were able to be vulnerable, we also directly just speak after them. And if the role model is somebody that was not also vulnerable, we just think that is the way of life. And going to our tradition as well, lastly, you see that growing up, you see, because of certain rituals that all those old people back then needed to do, a king does not cry because of certain ritual or ritualistic characteristic that is associated with it. So they just brought it out that a king is the figure of the society. So if he doesn't cry, no man should cry as well. Or some of these Ogun, Shango, and the rest of them that we have in our tribe, that some other people also have in other tribes like that. So because of that, we just assume that those are the norms and we bring it down, not knowing that those things, we are no longer practicing many of those things nowadays. And so as well, because we are no longer practicing them, to keep a male child or an adult male mute is no longer one of those things. In fact, one of the ways by which we know an individual is in tune is by them, their ability to communicate. So a man should not only talk, a man should not only be vulnerable, be very vulnerable, because one, is able to catharsis, is able to express himself. Number two, it relieves him. Number three, it helps others too that are coming to see, that are seeing, to say, okay, this is now the way to go. And that is why a few years ago, we started hearing that word Sorosoke, every here and there. So yes, these are some of the factors that actually affect the vulnerability of man within our environment. Thank you.
Thank you so very much, Dr. Olubenga Hoka. You mentioned something earlier, and that was the fact that when they shut up a child, eventually the child retrieves into themselves, withdraws into themselves. And most times it's like, oh, the child is the quiet one. And that's that. I remember something that happened with a patient recently, and the child broke down. And eventually the mom was like, no, and this is a child who doesn't disturb me. This is a child who doesn't give me problems. This is a child who doesn't do this. But again, this is a child who you have told over and over to not show the sign of vulnerability, to not express himself, to not do a whole lot of things. And now this is opening up our mind that yes, let's allow them to also talk. Let's allow them to also express themselves. I recall meeting a young boy who just lost a father, and everybody say, "You are now the man." And the boy said, "I do not want to be a man. I missed my father. I want my father back." And for a lot of people, they just didn't understand that because they felt they were helping him to just man up and just be there. But again, it's a lot. And Dr. Adeshina will now be talking to us about how can we begin to dismantle the stigma that strong men don't cry, or the real men don't talk? How do we begin to break all of this down to allow men to begin to function adaptively? Over to you, Dr. Additional.
Well, this is a call to action for every one of us, and I'm glad that at Yaba Psychiatric Hospital we are doing this today to find a solution to the challenges men face in assessing, mental health care and in destigmatizing the concept of men don't cry, men are strong, men must be this, men must be that. Well, the first thing to do is what we call inclusive advocacy. And just like I said, is what we are doing today. When we are advocating for health, when we are advocating for social welfare services, we should also remember to include men. Most times, at the level of advocacy and policy making, what you will hear is special health intervention for vulnerable groups. And by the time they list the vulnerable groups, you will hear children, you will hear women, you will hear the elderly. So where are the men? Deliberately discarded, neglected, or thrown away. And that is a problem. So for us to be able to find a solution, then we must really remember that some people also exist somewhere called men, and their health must also be provided for and must be well taken care of. So that is one of the things that we can do to actually find a solution to the problem on ground. Another thing is what we call integration of mental health care into general health clinics. There are some health clinics that men find easy to attend. For example, a man with high blood pressure, a man who has stroke finds it easy to enter a cardiology clinic. A man in his old age having problems with passing urine, finds it easy to enter a urology clinic. These are places that men are known to find one form of help or support. So what we can do is we can incorporate mental health care into these clinics so that it will be easy to have access to these men, and also it will be easy to screen them as actively to be able to identify who and who needs help and who should get some form of support or treatment at any point in time. Another thing I will talk about is the concept of telepsychiatry. We must understand that the world has advanced significantly, and that is actually one of the blessings of the COVID-19, which has brought technology into the mental health care practice. So telepsychiatry is going to ensure that the identity of men is preserved, their secrecy and their privacy is also preserved. So a man can have access to mental health care services without actually showing his face, without everybody actually seeing that, Chief Lagbaja is entering Dr. Akintoye's therapy room. Pastor so is entering Dr. Adesina's psychiatric consultation clinic. So their identity, their privacy, their secrecy will be preserved while they are able to get the necessary help or assistance. Also of importance is the concept of workplace mental health services. It's also important to know that if we bring mental health care services into the workplace, where peers, men of same age brackets, colleagues can actually have access to mental health care, it actually helps to also destigmatize mental health services and the concept of this concept of men are strong and should not cry and should not be vulnerable. Then the last thing is that the society has a lot of role to play. And when we talk about the society, we are picking it from the micro society, which is the family. The wife of a man has a role to play. The children have a role to play. Other family members have a role to play. Colleagues have a role to play. Church members, mosque members, landlord community association, everybody, market women, everybody have a role to play in understanding the fact that men are also human and recognizing the fact that vulnerability is not a sign of weakness, rather is a sign of strength. And that should be identified and also applied for men in general. Thank you very much.
Thank you so very much, Dr. Adesina. So profound. Dr. Adesina said to us, vulnerability is not a sign of weakness. They are human too. And for me, it's only in movies that superheroes don't die. In real life, they die. And so we must understand also that they need the care. But he has a very pertinent question, and that is, when we do all of those policies, sometimes we tend to just leave out the men because we feel they should be the one that is carrying everybody. But who carries them? Who supports them? How we don't even most times check in on them. All that we do is we place demands on them, and then we expect them to be able to meet up with them. And if they're not able to meet up, then we tag them as not being useful, as lazy, or whatever have you. Now, Dr. Olugbenga Koka will be talking to us as some healthy outlets or coping strategies that men can adopt to maintain their own emotional health or emotional balance, even as they function as individuals. Over to you, Dr. Koka.
Thank you, Ma. So, healthy coping outlets. So I'll say breathe, breathe, breathe. Every man in our environment needs to breathe. We have to teach our little children to breathe. We have to teach the adolescent to breathe. We have to teach the man, the grown-up man, to breathe, to learn to relax and breathe. And when I say breathe, there are certain things that we need to do to be able to exhale or breathe appropriately per time. The first one is self-awareness. So because one size does not fit all, it becomes very important that an individual becomes self-aware. One, I'm aware of my genetic loading. Two, I'm aware of the environmental stressors and distresses that I have around me, so I know how to position myself to appropriately cope with these things. So by self-awareness, we talk about self-assessment, and from self-assessment, we're able to assess our own stress bucket. How big, how small is this stress bucket? Then what are the genetic loading that I have? What are my health and fitness status? And what do I need to do per time to be able to put them in top gear or to nurture it to maturity? Like we say, a diagnosis is not a life sentence. So, but when we are aware of it, we know exactly what to do. So that is the first part, the part of an assessment. Then moving from there, after the assessment, what next? The assessor must get to the point where they are now able to bridge the gap. We call it the knowledge gap. The knowledge gap, like I've said before, individual differences. So now that we know, we work with relevant information to nurture our own individual health per time. Relevant information to nurture our mental health or emotional health per time. Like we used to say, that common sense will always drive common results. For people that need to accomplish uncommon results, to improve on their longevity, to live healthy and happy per time, they need certain information that is specific, tailored specifically to them as an individual self, so that they are able to now maximize the opportunity that life presents. Take, for instance, now we are talking about distress tolerance as one of the things that we need to learn. We say every child is born with 100% of emotion, but is born with zero emotional regulation skills. So emotional regulation skills are not the things that we learn by age. They must be adequately taught if an individual is going to do well emotionally. So one, learning distress tolerance. Two, learning coping skills. And three, problem solving skills. These are very, very vital as it relates to you, as it relates to your environment, as it relates to your personality, and as it relates to certain persons or certain things that has to peculiarly have to do with your own individual life. Those are very, very important. That is why learning is very important and is very key, which is number two. Then the third one is understanding the power of rituals and routine. Because I can tell you that now, drink adequate water so that you can stay hydrated, eat healthy food so that you can be good. But when somebody drinks water today because we say it, and in another 1 week, he does not drink or take anything, then what happens? The person is dehydrated. And dehydration, as we know, can actually cause psychosis, in some cases, hallucinations, and a lot of other things like that. So understanding the power of rituals and routine. Number one, how well do I sleep? When should I go to bed? Why should I go to bed? What are the sleep hygienes I need to keep? What are the sleep routine that I need to keep? When it comes to physical exercise, when should I exercise? How often should I exercise? What is the minimum for me? Which one is too much that can actually break or damage my physical health? When it talks about mindfulness practices like yoga, tai chi, even simple things like simple yoga dances like that, or for people that are younger that can do yoga insanity. Very important. Healthy food, appropriate hydration, like I've said, then checkups and prescription regimen. Some of us, we have glasses, but we don't use them regularly, so the eye keeps deteriorating. Some of us, we have medications that have been prescribed to us at the hospital, but how often say, I have forgotten, even ordinary malaria medication. So those things are very, very important. Very, very important. We say avoid sedentary lifestyle. Avoid sedentary lifestyle. Somebody says comparing yourself with another person is not a wise decision to make, whereas we compare ourselves ourselves with our previous self. Say, how am I doing? How did I do yesterday? Have I been able to improve on these things today? And in the bit to say this third one, which is understanding the power of ritual and routine, I want you to quickly write down now. You say, okay, what are the things that I do daily? What are the things that I do daily? Write down 5 things, 6 things, 7 things that you do daily and check. Take, for instance, say, I wake up in the morning, I eat, I pray, I study, then I go out to work. And maybe I don't go out to work on Saturday, on Sunday, I will go out to work out. So I wake up, I eat, I pray, I read, then I go out. So now these particular 5 things that I do daily, in another 5 years, where will it position me? Because a lot of us don't know that our future is actually resident in our rituals. So what are your rituals? Then how is it helping you? So it's important for us to know these things. That one, we need to settle down and calm ourselves down. Even though the environment is running very fast and is very, very running very fast, we need to slow down and say, breathe. What do I need to do at this time? Am I aware of myself before I start running? Like we say, when we buy a product from the market, when we buy that product, it comes with a user manual. And that particular manual contains the do's and don'ts. Do I know myself? What is my own user manual? By reason of assessment, we're able to get that. And we're able to know the level of hydration we require. Like Dr. Additional said that blood pressure, when certain men come to the hospital, because they have not been checking, people that are predisposed, just like every one of us, we're able to know and we monitor it adequately. There are some businesses that people with high blood pressure do not do. That's when I say your container is on top of the sea, it's coming. And without insurance, calculated risk. So those things we do not do. There are some, like he has said, we don't gamble, we don't put ourselves at risk so that the blood pressure does not rise. The same thing. There are certain things that are very simple, very, very simple, but that we need to do on daily basis. Very simple daily basis. But if we do it haphazardly, we'll get haphazard result. But if we do it daily, we'll get the daily result, like I have said. Don't forget that there are no mountains anywhere. Every man's ignorance is in mountain. When we were in junior schools, we used to say, oh, we develop sickness because exam is coming. Now, when they bring those exams, we write it. That means what used to be a mountain then, by reason of knowledge gap, we have overcome them. So what is a mountain in front of you today, especially when it comes to your health, your mental and emotional health too, is a function of knowledge gap. So when we learn, we know. When we know, we practice. And when we practice, our life will be the best for it. Thank you very much, ladies and gentlemen.
Thank you so very much. This is awesome. Very, very awesome. We want to appreciate everyone, yes, again for this. Dr. Ayegbeni sent a comment. Thank you, Dr. Additional. The current trained men are protectors, but query providers in Western country. It has been observed that men that take their partner as co-provider with good support from partner has improved lifespan. Yeah, when you have people who are quite supportive of your dreams, your aspirations, it helps you so much to also be able to do better. And I quite agree with that. But there is a question here, Dr. Additional. You mentioned embracing vulnerability, and somebody is asking, how then can society encourage men to embrace vulnerability as a strength rather than weakness? Over to you, Dr. Additional.
Okay, so embracing vulnerability as a sign of strength rather than weakness requires a mindset shift and also a generational shift. So everybody has a role to play. The individuals, the men, the people in question, who are the men, have a role to play by actually understanding the fact that vulnerability, expressing their emotion, feeling emotions, expressing their emotions, and seeking support, seeking help is actually a sign of strength, not weakness. Every other person in the family has a role to play. The wife has a role to play. The children have a role to play by providing support. It's when the home front is supportive enough that a man will feel the calmness and the genuinity to actually open up and seek help. So the family has a role to play. Then also, the society, we have a role to play. And that's why I mentioned the generational mind shift. If we start now, it's going to actually influence the generations that are coming. Dr. Coker mentioned something about raising a child and how it influences who the person becomes as an adult. As a family, as a society, we need to understand that. We need to understand the fact that our children must be given the opportunity to express themselves. They must be given the opportunity to express themselves, not just express their concerns, not just express their success, not just express their wants. They must also be given the opportunity to actually express their problems, to express their fears. So these are things that we have to do as a society. And as professionals, we also have our roles. Part of our roles are advocacy. We are the ones that understand these things more, and we are the ones that can actually tell the world and actually educate the world so that we can have that required mind shifts. Education, like Dr. Oka mentioned, education actually brings about that mind shifts. When you educate people consistently, let them know what are the pros and cons of what is on ground, what are the pros and cons of where we are shifting to. The pros and cons of seeing vulnerability as a weakness and the pros and cons of seeing vulnerability as a strength. That is where we are shifting to. So when everybody sees this, we'll be able to weigh, and they will be able to weigh those pros and cons, and there will actually be those mindset shifts and also the generational shifts. Thank you very much.
Thank you so very much, Dr. Adesina. One thing that Dr. Adesina had said is there should be a mind shift, because without that, we won't be able to achieve that which we are expected to do. And again, our society should also be well positioned in the fact that we are ready to accept men, just don't see them as human, nothing more. Just see them as individuals, just like yourself. So when they are vulnerable, we do not judge them. I think it's that sense of judgment that will bring to the fore that oftentimes makes them to hide and not, oh, you are crying. Why would you cry? Dear, no. And then we do not allow them to express themselves. I think it's just important that we allow them to be themselves. Dr. Koka, somebody sent me a message, and what he said after you had talked about the coping skills, he said, what if your current realities are not shifting? You have tried to cope, and honestly, you are tired. He said, what can you do? Over to you, Dr. Koka.
Thank you very much for that question. That's a very, very brilliant question. So that is exactly what we are talking about here. So number one is that everybody is somewhere in between on the value chain. I repeat, everybody is somewhere in between on the value chain. This is what it means. Whatever problem you think you are facing now, somebody has faced it before, somewhere, somehow, and they have already provided solution to it. So everybody is somewhere on the value chain. That is why we say find. That is why the number fourth thing, which is social connectedness, is very, very important. We find help, we use help, because certain times our realities may not change. If an individual does not know what to do to move to the next level, that person will be stuck perpetually at that particular level. Not necessarily because there's no next level or the opportunities don't abound, but if the person does not see it or does not know what it entails to get there, that person can be perpetually stuck. So yes, number one, I would say, first of all, find out who are the four, five, 6, or 7 closest person to your life. Like we used to say, law of association, that my life cannot be better than the type of relationship that I keep. Maybe it is time to move out of that circle so that we can now start moving with other people. We are not trying to be like, it's not a wannabe type of ideology, but it is the idea that I want to learn or move with people that know more than me so that I can glean more insights. And from the insight I glean from them, I'll now be able to respond appropriately. Every time we put in the wrong response in an exam is equal to failure. And when a child fails, he has to retake that exam. The same thing with life. Every time we put in a wrong response, hustle is not the way to go. Adequate right knowledge is the way to go. So when we do the right thing, we get the right result. So this individual needs to start thinking of, I need to move out of the current circle of people because they have not been able to help me. If they have been able to, we will not be in that situation by now. So for us to move out of that situation into a better space, I need better people around me. They don't need me, but I need them. So it is me that will go to go and look for them. So, and when I get that particular thing, then I also pay it forward to also teach other people. But that you are the first person to encounter that problem, that is a no-no. And that's why we also have professionals at the Federal Neuropsychiatric Hospital here at Yaba, that they can actually help you. We don't only deal with psychopathology, we also deal with positive psychology. We are able to move you from level 1 to level 2 to level 3 to level 4, or in every strata, from business to career to mental health to emotional health, areas of your life. And if you do it, take the first step today by reaching out, and you see that the story will be different. Thank you very much.
Thank you so very much, Dr. Coker, for that. Everyone is somewhere on the value chain. And so you must locate where you are, first of all. And he earlier has spoken about awareness. And so we must understand that. So, when you're aware, you're able to move on and see how you could make the necessary changes that you should. Professor Badru, thank you so very much. He had highlighted some of the things as our speakers have spoken about on the chat box. I think it's just important that some of us are here, we could just screenshot it. That they become very useful for us. Understanding the power of rituals and routine, coping and problem-solving skills, self-awareness, avoiding toxicity, toxic masculinity and objectification in women and men, integration on mental health in male-sensitive facilities, the usage of telehealth, mind and generational shift, facilitating opportunities and windows for everyone to express themselves productively, and everyone is somewhere on the value chain. We'll be moving closer to the end of gradually moving closely to the end of this webinar today, and I'm going to ask our speakers to give us a last word to our audience. What's your last word to them, Dr. Additional?
Thank you, Dr. Akintoye. My last word would be that vulnerability, everybody should see vulnerability as a sign of strength rather than a sign of weakness. And seeing it this way will actually help us to know when we have difficulties, when the difficulties are beyond what we can handle ourselves, when to seek help, where to seek help, and how to make use of the help. Thank you.
Thank you so very much, Dr. Additional. Be vulnerable. It allows people to help you. You can get the help that you need, and that would help you. And that's what Dr. Additional had said. Vulnerability is not a sign of weakness, not in any way. Dr. Coker, your last word, please.
Thank you very much, Ma, once again. So, like they say, that strong men don't cry. I quite say the opposite today, that strong men don't only cry, they wail. Real men don't talk. We don't just talk, but we communicate, we connect, we make sense, because we are a generation of people that are breaking the silence, that is speaking up, that is speaking loud, and that is making sense. So please find your tribe today. Join your tribe. In fact, join us and see a shift step by step. It is doable, but somebody needs to start, and that person is me and you. Thank you very much.
Thank you so very much. I love that. They don't just cry, they wail. So if it means moving into the bedroom or the toilet and go and put on the shower and wailing, then when you finish wailing, now come out and then life will continue. Thank you so very much for that. It's been wonderful with Dr. Additional and Dr. Coker today. Okay, Mr. Lara said, Dr. Additional and Dr. Coker, thank you very much for this wonderful discussion. Vivian Adeyemi says, everyone should understand the vulnerability isn't weakness, but shows you are human. Thank you so very much. On this call, we'll be coming to the end of today's webinar. Incidentally, it happens to be the last webinar for the year 2025. And the medical director is here to say thank you to everyone. You have ridden with us through this year, from January down to this last moment. Thank you so very much. So the medical director, please can you unmute the medical director? Let him come on and say thank you to everyone who had always been on the call with us each time we present our webinars. Dr. Owe, sir.
Thank you very much, Dr. Kemi Akintoye. I must say a big thank you to you for this program. You have been anchoring this program for the past 11 months, non-stop, coming up on monthly basis. I say a big thank you to you for working hard, for making this program run smoothly. I say a big thank you to you. I also want to thank our presenter today, Dr. Adeshina, Dr. Koka. You have done excellently well to highlight the mental health issues in men and the way out. We really appreciate you, and we pray that God will continue to bless you. And to all our participants, from the beginning of the year, some people have been attending this webinar on regular basis every month for the past 11 months. We say a big thank you to you for making use of your time and your resources for the success of this program. We say a big thank you to you. And we also want to encourage you that whenever we come up on this program, help us spread the gospel, spread the link to other platforms to which you belong so that they'll be able to benefit from the wealth of knowledge of all our experts that we are bringing up on regular basis. Just like Dr. Kemi Akitoye said, today is the last day for this year. The last program for this year is what we have this morning. And we would like to go on break for people to be able to enjoy themselves during Christmas season. And by the grace of God, we are going to come back more powerful with a lot of interesting topics in the month of January 2026, by the grace of God. By the time we come back, we will all be alive, hale and hearty. And that I will see all of you by the grace of God next year. Thank you, and God bless you. Over to you, Dr. Kemi Akitoye.
Thank you, Medical Director, sir. You have given us a platform to do this. If you had not given us the support, we would not be able to turn out each month like we do. So we want to say thank you too, sir, for allowing us and encouraging us all the way. So the Medical Director had appreciated everyone. Again, I want to say thank you. Thank you. Until we come your way again next year by the grace of God, please feel free to go to our YouTube page, Yaba Voice, FMPHY, and then you will get recordings of the past episodes of the webinars that we had done in the past. We have very interesting topics there, right from gambling, substance abuse, no suicide, and quite a lot. Even children and women. We had also a topic, a session for the elderly. So there's something that you can relate to there. So please go right ahead and check previous episodes, and then you would be able to, just spread to other people, or as well, just take something good for yourself. And so until we'll come your way again next year, by the grace of God, please remember the vulnerability is not a weakness. If there's a reason to be vulnerable, please do get help, get the support that you need. If you need to wail. If you need to cry. But after that, get back again and other things like that. All right, so the site is FMP Yaba Voice FMPHY on YouTube. Yaba Voice FMPHY. On YouTube, you will see previous episodes. I will tell you for the past 5 years, we've had episodes so you can always get something relatable to you. I want to say thank you again to Mr. Ladeji, who has been our technical crew, and he has always also been very supportive. Dr. Deshina, Dr. Koka, thank you so very much. Until we come your way, please remember there is no health without mental health. So take care of your mental health and stay safe out there. Bye-bye.
Bye. Thank you.
Yaba Voice FMPHY. Yaba Voice FMPHY.